As a medical assisting student, it's important for you to create a strong resume that speaks to your skills and abilities, whether you have experience in healthcare or not. Many transferable skills can and should be considered when developing a strong job search document, as well as speaking to those skills in any interviewing situation. Customer service or customer care can translate into patient care. Communication in any setting is excellent when supporting other medical professionals or patients. Database management, POS systems, or IT work, that can all support the ease of adaptability with electronic health records. Plus, you start hands-on experience with electronic medical records in one of your courses. So let's take a look at some resume samples and go over what they contain and what they do not contain. There are options when it comes to formatting the top portion of your resume with your contact information, but it must contain your legal name, your address, whether that's your complete address or simply city, state, and zip code, one phone number, and a personal email address that links directly to your name. Whether you're a proud mom of 4 or you're a volleyball lover at gmail.com, we don't want to know about those things in your professional personal email address. Again, you might use your first initial and your last name at gmail.com or your first name dot last name at yahoo.com. Just make sure that that personal email address ties specifically to your name. Be sure that the information in your professional statement is targeted to your MA education, skills, and professional abilities, and provides information that's going to help you stand out from other candidates. So let's read this example. Bilingual medical assistant student, Spanish-English, skilled in working with diverse populations, highly motivated with over 8 years of exceptional customer service experience, driven to provide superior patient care and support to a team of medical professionals, strong communication skills with the ability to quickly adapt to new clinical policies and procedures. What this statement does not contain is it does not speak to what this individual is seeking, but more so what they have to offer the employer as well as the position. And that's what any employer would want to see. What I really like is the fact that they indicated kind of a passion statement here, what they're driven to provide, that superior patient care, which any healthcare employer would want to see in a qualified candidate. This individual then drops down to highlight their skills and their qualifications, and you'll notice that most of this information is going to come directly out of their coursework that they covered or their labs while they were going through their medical assisting education. And then they move directly into that education to highlight their medical assisting diploma, which is your credential that you're working toward earning here at Rasmussen College. And they highlight the fact that they are CPR and first aid certified. And this person also had a dental assistant certification from Illinois State Dental Society in Chicago, Illinois. So absolutely accurate to include that here. What this does not include is information from high school. Once you're enrolled in a college, information from high school should not be on your resume any longer. This also does not include a GPA at this point, and this individual at that time did not have a GPA of 3.5 or higher, and I do not recommend including a GPA below a 3.5. It also doesn't include any information from previous schools that this person may have attended. Let's say, for example, you started off your schooling as a nursing assistant. You initially wanted to go and you went for maybe a quarter or two to get your CNA, but you didn't finish. If you didn't earn that credential, then that information should not be in your education section either. In this example, you'll see that this individual combined a professional statement with an initial list of skills, again, probably related to the coursework, and then dropped immediately down into that education and certifications section. This example, again, breaks out that professional statement, but then moves into their education, highlighting their credential and their GPA, and then moves into that relevant skills and coursework, whether it's skills and qualification, skills and core competencies, skills and coursework, whatever you choose to use as a header title for your skills section is perfectly fine, as long as you're bringing in the healthcare related terms and the medical assisting related terms from your schooling, and if you have a healthcare background of some sort, make sure that you're including some skill terminology from your professional experience as well, if you have that. And then they broke out their certifications and their training separate, indicating that they're going to be sitting for their CMA, that they're BLS certified, that they're HIPAA and OSHA trained. So a couple of different options on how you break out the first third to half of your resume, just making sure that that first third to half of your resume is focused in healthcare and medical assisting. So let's break down some information within the professional experience section. And again, whether you have experience in healthcare or you don't, you want to make sure that you're highlighting key information that relates to the accomplishments within those positions that you held. Make sure that you are developing strong accomplishment statements. There's a difference between a list of job duties. Some people like to list out 6, 7, 8, 9, 10 different job duties that they had within a particular position that they held, versus a really strong accomplishment statement that states those job responsibilities and what you did with those responsibilities that you were given. So let's just read a couple of these. Assist teachers with children ages newborn to kindergarten, helping the children to complete their tasks or assignments and encouraging them to learn colors, numbers, and shapes in Spanish. Why? To support second language learning within the classroom. So you see that last portion of that statement kind of brings purpose to those actions that were completed. Drop down to the dental assistant receptionist position. Maintain doctor's documents, patient charts, and assisted other team members with administrative tasks. I'm going to ask the why again here. To uphold office procedures and maintain a successful workflow environment. So again, bringing purpose to that action, to that job responsibility. And not every single statement that you have underneath each position is going to be that thorough and in-depth, but the more that you can bring purpose to those statements, the more it helps the reader who's reviewing your information on your resume to know that you understood your job responsibilities, or understand your job responsibilities if you're currently holding the position, and you know what to do with those responsibilities and what the purpose is behind them. I want to take a look at this example as well. So this individual happened to have a lot of CNA experience, and on top of that, this person held a student worker position, data entry accounting assistant position, receptionist position. They held multiple jobs at one time, but they really wanted to make sure that they were highlighting the healthcare experience first and mentioning the additional experience, because even though it wasn't healthcare related, that financial aid computer lab, the accounting and data entry, and the receptionist tie back to the administrative and the IT related electronic health records, so to speak, that is going to play a role in performing their job responsibilities as a medical assistant. So because this individual had so much certified nursing assistant positions and experience, we kind of grouped all of that together at the top and then just highlighted, almost like an additional skills area, what some of those responsibilities were. And again, added the additional experience at the bottom so that it was at least highlighted and could be brought up successfully within an interviewing situation. As you can see, there is not an exact science to writing a resume, but always remember to have at least that top third to the top half of your resume highlighting healthcare and MA-related skills and qualifications. Remember that resumes are a marketing tool. Think transferable and field-related skills when creating your document. Be specific and intentional with the information that you include, and please remember to always be truthful about your accomplishments and your work history. Your work history, your schooling, this is, all of this information, the skills that you include. You're going to school for these things. This is what you're passionate about, and this information needs to come through on your resume. For individual support with your resume, because not everyone's resume is going to look the same, not everybody's professional history is going to look the same, be sure that you're reaching out to your career services advisor.